Hey everybody, we are back in Nicaragua still, and my buddy Julio came over and he had a small motorcycle accident, well, pretty good motorcycle accident about 2 months ago. He was riding his motorcycle and his foot got caught underneath the shifter peg and ran over it, and he ruptured his Achilles tendon, so he severed it. And they've opened it up and they've pinned it back to the bone. So that's really good, but he's got a lot of pain with flexion and dorsiflexion. He's got pain both on the Achilles. So with something like this, a local injury like this, I definitely want to treat the local area. We've got to break up that scar tissue, and the adhesions are what's going to cause a lot of pain. The chi and blood stagnation, no bueno, right? So I've done some local stuff. Now this is Julio's first ever acupuncture treatment, so we wanted to take it a little bit slow and like no problem. I started out on the wrist, okay? So I went opposite limb, and you can consider that like pain and injury in the Achilles includes like kidney and bladder meridian. And so kidney and bladder are paired with heart and small intestine, and you can see that the tendon image is really nice here. So what I've done is I've needled across the tendon in the same area where the pain is on the ankle. We needled that, and I got him to move his foot a lot. When I'm doing stuff like this, when I do the distal aspect like that, especially for physical injuries, a really good way to go and consider is to needle those points. I pressed in, found the area that had pain, and then when I needled those, I got him to move the foot, and that's going to do two things for us. One, it's going to like give a sensation that things are moving. Oh, one of my leads disappeared on my. There we go. Bueno, no problema. Okay. One of my leads came off, and so my machine shorted out here. So you tell me when, yeah? See?
Okay.
Just coming back to bring that up again. I don't want to lose him on his first treatment.
More?
See? Yeah?
More? Yeah.
There.
It's good.
It's good. Yeah, see, that's higher than we were. That's great. So, like I was saying, I really want to get him to move once I've put these distal needles in. It'll start to break the adhesions, move some chi and blood, and open up that tissue. And it also gives us an opportunity for them to tell us where the pain has moved to, and then I can add some more needles. So that's what I did. I added an extra needle afterwards. And then real simple, I wanted to go real simple, real slow. So I've just gone down either side of the tendon, both sides, and I'm just running my current across the side just to break up some of that stagnation to start with. I'll work on the scar tissue later. Maybe I'll needle a little bit more locally where the adhesions are on the bone where the staples were, depending upon what the pain feels like. Obviously the thing that I'm considering right now is that I don't want to push too much. And this is our first session, and you know, everybody's a little bit nervous about it. So just wanted to go nice and slow, real easy treatment, but I think it's going to take down some of the pain, and that's going to be a good thing to help in terms of clear up some of that stagnation. And then the second, third round, I'll go a little bit more locally, but we'll kind of keep monitoring and see how we're doing. The pain really changed when we did the distal needling, and I think this is going to help quite a bit. So we'll go from there. Anyway, if you want to play around and do some of this stuff with me, we don't have our clinic set up as of this moment right now, but in the coming weeks we are definitely going to get a place set up, probably in Granada. We'll see lots and lots of treatments. We're going to be doing stuff like this all the time. And if you want to come hang out in paradise and play with us and learn some more acupuncture techniques, this is what we're doing. We're going to help some people and hopefully help you get your techniques all set up. Right on.